It is important to note that when we talk of disruptive behaviour, we are usually referring to a pattern of behaviour rather than an isolated event. Healthcare has changed over the past few decades, and today it truly is a team sport. It requires more respectful collaboration and interdisciplinary collegiality than we have traditionally seen in the past. Therefore, disruptive behaviour becomes very relevant because it can have a significant negative impact both on the delivery of patient care and also on the smooth running of medical or academic departments. There's been evidence of medical error and other adverse outcomes in provision of quality care as a result of disruptive behaviour. Disruptive behaviour has a tremendous ability to stifle the cultivation of collegiality, and it can also cause an increase in staff turnover at a time when we struggle to recruit and retain providers in all disciplines. From an administration perspective, more time gets spent on conflict management and harassment complaints, etc. In addition, more meetings with disgruntled staff, patients and families are often required. As well as patient care issues, disruptive behaviour can also have a negative impact on the learning environment by modelling inappropriate behaviour for students and residents, by impairing their ability to achieve clinical skills, and by damaging the collaborative culture that's necessary for learning. Therefore, for many good reasons, a pattern of behaviour that is considered to be disrespectful or non-collegial is simply no longer acceptable in healthcare. In fact, such behaviour can become very bothersome or disruptive for others. This is why disruptive behaviour has become such a hot topic in recent years. While certainly not at epidemic proportions, it is estimated that 3 to 5% of physicians demonstrate behaviour that could be considered to be disruptive. It is important to distinguish between disruptive behaviour and incompetent or unskilled behaviour. It is not uncommon for the physician demonstrating disruptive behaviour to be very skilled technically and also very competent regarding their medical knowledge. Frequently they are experts in their field, very busy and a champion for their patients. They commonly see themselves as clinically superior and others as less competent. An insistence that others submit to their way is a familiar characteristic, and an excessive devotion to work to the exclusion of personal and interpersonal relationships is common. In addition, there's often a lack of insight with regard to the impact their behaviour has on others, and although these physicians often become more isolated, lonely and in need of collegial help, ironically, because of lack of insight, it is rare that they will seek help themselves. To make things worse, colleagues are often reluctant to engage with someone who appears to be the source of the disruptive hurricane.